Hi, I'm Michelle Adubato. The North Ward Center is committed to educating the public about the importance of community programs that give all New Jersey residents a chance for a better life. That's why we're proud to support the important educational programming produced by the Caucus Educational Corporation.
Funding for this edition of Caucus New Jersey has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community, the New Jersey State Nurses Association, and the Institute for Nurses, advocating, positioning, educating NJ's RNs. The New Jersey Association of Health Underwriters, New Jersey's benefits specialist. The Community Food Bank of New Jersey. Find out how you can help. The North Ward Center. Josh S. Weston. And by Century 21 Construction. Promotional support provided by NJ.com. Small news, big news, true Jersey. And by Meadowlands Regional Chamber, building essential connections that drive business growth.
Welcome to Caucus, New Jersey. I'm Steve Adubato. People are increasingly enrolling for health insurance, but education and outreach are still needed. Joining me in the studio to discuss healthcare reform in the city of Newark, we have Maura Collinsgru, Healthcare Program Director at New Jersey Citizen Action. Roslyn Collins, President and CEO of Planned Parenthood of Metropolitan New Jersey. Rakelmis Montas, who is Health Services Unit Manager at Casa de Pedro. We're also joined by Dr. Natale-Pereira, Division Director of General Internal Medicine at Rutgers-New Jersey Medical School. And I want to thank you all for joining us. Let's talk about where we are in the city of Newark when it comes to the ACA, but also the question, Maura, of where we need to go. Why are we talking about, frankly, the ACA in Newark as opposed to the state of New Jersey or the country? Why is it any different?
Well, in Newark, we have a large population of people who are still uninsured. We've made great progress. We've cut the uninsured rate approximately in half across the state. But we know from where we started and where we are now that we still have tens of thousands of people living in Newark and the surrounding county who are eligible for coverage who are not yet enrolled.
Okay, let's play this out. The question is, what is it about the population in and around the city of Newark that would have a higher percentage of people not enrolled? A lot of publicity, a lot of information, a lot of people saying, here it is, Obamacare, the Affordable Care Act, it's happening. What did they miss? Did they miss the email? Did they miss the memo?
I think there's a limitation of knowledge, a knowledge base, I think, that happens within our city. So look at Newark's 280,000 people, right?
And 22 square miles?
Yes, right? So when you look at the city and you begin to look at who can get what portion of the reform, right? So there's the Medicaid Expansion part of the reform.
Could you explain that part? Because we're doing okay there, right?
On the Medicaid Expansion.
Right, so we have expanded
right
on Medicaid. More people are signing up for Medicaid, and that's a good thing.
And that's a good thing.
Where are we falling short?
And I think that's where we probably will benefit the most in the city is from the expansion of Medicaid. When you look at the exchange, for example, there's a higher income level, and you probably know this better than I know. The healthcare exchange. The healthcare
so let's be
exchange.
Clear. I don't want to assume that people know any of this, because the truth is that's a good assumption. The healthcare exchange. People go on the internet. They go on healthcare.gov. They go, okay, I'm going to shop for insurance coverage. They go to the exchange, and they find options, right? Is that what we're referring to?
Correct.
We're falling down there? Is that where we're falling down?
We're going to I would say back it up a little bit.
Back up from that?
Back up from that, because there's a need for information and there's a need for hand-holding, right? This is a really complex system, and I think it's too much to ask people to just go to healthcare.gov and sign up.
Correct.
What we found is that people need one-to-one assistance. And so there are a variety of resources on the ground in Newark and in the surrounding area to help people free enrollment assistance that they can access to help walk them through the process. And we find that people are more successful and end up having more knowledge and better knowledge, picking better options for themselves when they have that kind of assistance.
Well, let's talk this through a little bit. So let's talk about the women who you serve. By the way, make it clear what Planned Parenthood really is. Lots of people talk about it. I'm not sure people really know what Planned Parenthood really is.
So Planned Parenthood is an organization that provides reproductive health care in the city, and we provide services for women as well as men. And they're able to come into our organization, and through grants, we've also been able to provide services so that we can enroll people into health insurance.
So, Ms. Collins, what would be the connection between Planned Parenthood, the services you provide, and the Affordable Care Act?
Well, we knew that many of the patients that we see come to us and they do not have health insurance, so they're not able to actively participate in their health care. And we do provide subsidized care, so we're able to serve them, but they have other presenting health problems that they were not able to access health services for. And we knew that if we were able to assist in that regard, that not only would we be able to treat their presenting issues, but we would be able to give them an opportunity to get health care otherwise.
Sorry for interrupting. And you recently received a grant from the Healthcare Foundation to do what?
Foundation to enroll community members into health insurance.
And that's critically important to make that happen.
It was critically
and to assist them in that process.
So since 2012, we've been able to enroll 3,500 community residents into health insurance and enhanced Medicaid.
Ms. Montas, let me ask you this. Language. How important is language? How significant is language as a barrier to having people enroll, sign up, and get the health coverage they need in the city of Newark?
The language barrier is it's still a barrier, and it's something that we do try to address at La Casa because our staff
Explain La Casa de Don Pedro for those who do not know.
So La Casa de Don Pedro is an organization that was founded in 1972. So we're a nonprofit organization that services Newark and Essex County residents. So through grants that we get through the state, we're able to provide certain services to the community. So going back to what you mentioned about language, it is a big issue. We do see a lot of clients coming in that are not sure of what plans they would, they need to select based on their medical needs. What is the cost? What is their out-of-pocket cost, if any? So there's still a lot of lack of communication there between, just even the certified application counselors. A lot of time, if they're not bilingual, they're not able to relay that information to the residents, and that is really a problem.
So let's talk barriers for a second. Well, we'll also talk, by the way, you're going to see websites up throughout this program, and one of the keys to all the work that we've been doing as it relates to the Affordable Care Act, the implementation of it, the challenges surrounding the execution, the implementation of it, only for one purpose, to help educate and inform folks so they can take advantage of it. We don't debate it. That's on our other public affairs programs where we debate public policy issues. This program is to provide information so you can access it, get the information you need. But I am curious about this, penalties. The issue of penalties if people don't sign up. Doctor, feel free to jump in here.
Sure.
I know you know this as well from a policy perspective, Maura. There are penalties, and A, what are they, and B, have they changed for people who do not sign up for the Affordable Care Act?
Yes.
What are they right now?
Right now, there's $695 per adult, up to a maximum of $2,000 per household, or
no matter how poor a family is?
Or 2.5% of your income.
Right.
Oh.
So, you have a real incentive in that for people to sign up, right? If someone signs up for health care, what we do know is here in the state of New Jersey, 4 out of 5 people who sign up are able to sign up and get financial assistance. And that assistance means their premium, in effect, could be much less than what the actual penalty is.
Can people find
Yes.
out through your organization? Is that one of the things that you do?
Yes, Citizen Action. We do enrollment work at our Halsey Street office in Newark. People can get enrollment assistance there. We also have a website in conjunction with community-based partners and ACA outreach and enrollment agencies throughout the state called covernj.org.
Covernj.org.
Yes.
And that does what?
That is a website that allows people to actually go in and find local enrollment assistance in their own neighborhoods.
Follow up on that. Doctor, I want to follow up with you. The issue of primary care physicians in the city of Newark. And again, people may wonder, why are we talking about barriers? Well, you can't talk about getting things, improving things, unless you acknowledge barriers and obstacles.
It's a barrier.
Doctor, let me ask you, what is the barrier of primary care physicians, and what can and should we be doing about it? And are we doing?
At the basic of it is it's a numbers issue. It's just there's not enough, right? There's not enough people. If you look at the city, and we actually recently did a primary care task force assessment for the dean in looking at primary care for New Jersey Medical School, but how it extends as it relates to us within the city and the surrounding greater healthcare Newark area. And we looked at the local websites, the local insurers, Mary Group, Horizon, and a lot of people are listed as primary care doctors. But then when you really go down to the ground, they will tell you there's listed addresses in the city for doctors, but they're not necessarily there. They're not there all the time. And then you rely on, for example, at the medical school and at University Hospital, we have a big primary care practice because we're also a training institution.
Right.
So we can provide access that way. And traditionally, we always provided access to our largest cohort of charity care patients.
Charity care, those who can't afford it.
Those who can afford it at all, and many of which over the past 3 years have actually converted to the expansion of Medicaid or through the healthcare reform.
But Doctor, respectfully, it's not like there's going to be an influx of primary care physicians.
Not of primary care physicians.
But there are other ways to deal with it.
Right. So there are other providers
Yes.
who have closed the gap, and we've been very blessed for that. APNs, advanced practice nurses.
But here's my point. There's no reason for someone watching right now to say, you know what? There's no reason for me to sign up. There's no reason for me to enroll because there aren't enough primary care physicians. There are people to serve them, to provide quality medical care. That's not, while it's a challenge, it's not a reason not to sign up. I want to be clear.
It's not a reason not to sign up, absolutely. And I think that also there is, we have to do better in informing people where to go for care, which is also a limitation.
Where to go?
Where to go. So where are those primary care docs within the city? How accessible are they? Right? How accessible, rather than choosing the emergency room,
But they wouldn't even know where
example.
to go. They can go to Planned Parenthood. They can go to a federally qualified health center.
And those are our most reliable places, right? So,
but they don't know they don't know where that is.
Right. So that's to my point
How
of
could
access.
they find, we're going to a break right here. How could someone find out where an FQHC, in other ways known as a federally qualified healthcare center, how would someone find that out?
I think there's a website, the Newark Community
There
Health
is
Center
a website. But I think, the reliance on technology can't be, overstated.
Keep telling people, go to this site, go to that site.
You need to have the community-based organizations linking people to care. This is a real culture shift. It's new for people to have health insurance. We need people on the ground, one-on-one, helping them to navigate the system once they have that insurance.
Final point, Ms. Montas, and I'll go to break.
Oh, okay. And also what happens is that, a lot of the individuals that we service sometimes, don't know how to access maybe, the internet and maybe not have a computer home.
Talk about obstacles.
Yes. So then that's another reason why they do seek to come to organizations like La Casa and, other organizations to help them and guide them, every step of the way. This is what you do now. This is what you have to do next. So you need that coaching. It needs to be there.
Great point. Ms. Collins, when we come back, one of the things I want to talk about is the fact that some people don't even know that they qualify for Medicaid. We'll talk about that and other issues. We're talking about the Affordable Care Act, otherwise known as Obamacare, its implementation, effectiveness, and where we need to go, particularly in the city of Newark, New Jersey. Stay with us. We'll be right back.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD and follow us on Twitter at Steve Adubato.
Welcome back. We're talking about the Affordable Care Act, its implementation in the great city of Newark, otherwise known as Brick City. Let me ask you, Ms. Collins, when we went out to the break, I said, there are some people who don't even know that they qualify for Medicaid. How would you even know if you qualify?
Retrospectively, the state of New Jersey did not do a good job educating its residents about the Affordable Care Act when the opportunity became available. And the onus on that was delivered to the community-based organizations, and those people had to educate. And it's really been difficult. There's a lot of stigma around Medicaid, and often those people in the communities who are eligible for Medicaid, even the enhanced Medicaid, are reluctant to accept that service.
You say a stigma around federal money, taxpayer dollars, federal program to help those who don't have the financial means to get health insurance. There's a stigma around that?
There's a stigma around the kind of care that has been associated with with Medicaid and the kinds of places where the Medicaid card is accepted.
Let's break this down. So, Doctor, you need to jump in here. Is Ms. Collins saying in a very nice way that some people perceive the quality to be inferior?
Probably.
Is that not the case?
I think it actually works both ways.
By the way, I don't know if you're saying that. If you're not, you tell us you're not.
That is what
You're
I'm
talking
saying.
about stigma on the part of the clients.
Right.
In signing up.
In signing up.
That they don't think
Medicaid.
they're. Listen, I thought you were saying, and if I'm wrong, you'll tell me, that people think they're not going to get quality health care.
I'm saying that, and I'm also saying what you're saying as well.
Right. Stigma on the part of the actual client.
Well, let's deal with first issue. Is there any difference in the quality of the care you get?
Not from my point of view, there isn't. But I understand what Ms. Collins is saying, because I think where the stigma comes into is here we have a patient shows up in the practice with their Medicare card. And
Medicaid card.
Medicaid card. And for a lot of patients, having that Medicaid card means they have access. What they sometimes don't know is that access may be limited access, right? Because it's limited by the type of program that they got enrolled in, based on income, based on variables.
Right.
And that access also may give them access to primary care, but it doesn't necessarily give them access to super specialized care, because that is where the challenge begins. Not everyone that's a super specialist accepts Medicaid. And so, although we say now we have access, we enroll 500,000 people, there's much better than not having anything at all, but at the end of the day, they don't necessarily have access to everything. So it's a limitation to a certain extent.
But it is better than what we had before. But
I view it as much better than what we had before.
But it's educating the patients and the consumer so that they understand that.
That it is better, but there are limitations.
There are limitations.
Because of obviously
access.
economic reasons and other policy reasons. Go ahead.
Well, I think, too, that one of the breakdowns and why people don't know that they're eligible is because this was a real shift. The Affordable Care Act took Medicaid and expanded it in a way that it had never been before. So single adults who were working, who had full-time jobs, who weren't receiving general assistance could now receive Medicaid.
Were we not prepared for it?
Well, I think culturally, the stigma was that if you were on Medicaid, you weren't working,
Right.
you were on welfare.
Correct.
That's not the case under the expanded Medicaid program.
Right.
You know, most of the people receiving expanded Medicaid under that eligibility are full-time working adults. And there's the stigma I think we're fighting is pre-ACA, pre the
It is.
Affordable Care Act. The other thing that we did in expanding Medicaid and in introducing health insurance marketplaces is we expanded the pool of who's eligible. So many people, for instance, immigrants who are here less than 5 years, who weren't eligible for New Jersey family care, they now can go onto the health insurance marketplace and they can purchase health insurance. A lot of misinformation is out there and people don't know that they are eligible. So that's really where we need to do more education in helping to connect people to that coverage.
Jump back in here.
Yes, and that is really what we do at La Casa. So through educational workshops that we provide out to the community residents, we visit other agencies, New Jersey Citizen Action being one of the agencies who we collaborate with, where we do open enrollment events on site.
Describe open enrollment so people understand what that means.
So open enrollment, it's from November 1st to January 31st, where individuals that have insurance under the marketplace can go during that period of time and either change their plans or just enroll if they have never enrolled. So it's a time where if you have to do any changes to your plans, you can do that during that period.
So stay right there. We're taping this program on November the 3rd. It will air after. So say it airs or repeats after the open enrollment period. Are we saying, so to be really clear, since the role of this program is to educate and inform, what's the end of the open enrollment period?
January 31st.
So February 15th, right? Or Valentine's Day, February 14th. That's it, can't sign up? Is that what it means?
No.
See what I mean?
Yes and no, right?
Because here's what happens. People hear, oh, it's not the open enrollment period.
It's yes and
I'm
no.
done. I can't do it. Not true.
Right.
Is that not true?
No, I don't have too much knowledge of
Okay.
the
Help us
ACA.
understand, because a lot of
Ms.
people are
Maura
thinking,
would
I'm
know.
out.
Right.
Correct.
So after January 31st, you have special enrollment
Oh, a
periods.
special
Special
period.
enrollment period. So anyone who's had a life-changing circumstance, their income changes.
How about
they
you get
had
divorced?
You get divorced.
That's
you have a
special.
death in the family,
right.
a birth.
That allows you.
can.
Yes.
You have 60 days from the time of that event to enroll in healthcare. The other thing that's really important to know is that if you're eligible for New Jersey Family Care, which is the expanded Medicaid, you can sign up at any time all year long.
Okay. If you're eligible
confusing,
for
right?
New Jersey Family Care.
Right. So what we say to people is, it doesn't cost anything to ask. If you don't know, go to an enrollment agency like La Casa or New Jersey Citizen Action or a local healthcare provider and inquire what you might be eligible for.
Just ask. And you can go to Planned Parenthood and they just ask.
Yes.
And just
Right.
ask.
And for us, it's at the hospital, right? So at the hospital, when a client comes in and applies for charity care because they don't have any
Explain
type of
that, folks.
access,
Sorry for interrupting, doctor. They come into the emergency room.
they come into the emergency
and
room.
charity care is care because that is required to be provided because the state of New Jersey says that no one could be turned away from the emergency
Correct.
room. Is that correct?
It's subsidized care for the person who is not insured. That is what charity care is within a hospital system. It's not private insurance.
Right.
It's not for a private doctor. It's only for within the hospital.
Say someone wants to find out once they walk into that emergency department whether they could be eligible for to be covered.
Sure. Our financial officers within the hospital, when the reform began, everyone in New Jersey was mandated to learn how to help people enroll if you were in a healthcare system. So all of our financial officers within the hospital have the responsibility to offer and to interview that particular person who now will be covered by charity care in the meantime for their acute care in the emergency room to enroll, if they qualify, to enroll in some form of expansion, whether it's Medicaid or by the exchange. Or
I'm sorry for interrupting. A minute, actually less than a minute left. 10 seconds on the future of the ACA. All right, I'm putting you on the spot. Go ahead.
The future of the ACA is to continue to build on the success we have now. In Newark, continue to educate people, enroll people, and bring better health literacy to the community.
Future in Newark.
The education is going to be key, but the future looks good.
The future looks promising, but we still need a lot more work in the education piece and just targeting various places like colleges and just trying to really...
Outreach never stops. Finally?
Definitely critical for our citizens in Newark and absolutely important for them to know that they can access the healthcare system at multiple points and get help.
The education and outreach never stops, which is why we do what we do, and cannot thank you enough. Great job. That was excellent.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the Healthcare Foundation of New Jersey, the New Jersey State Nurses Association, and the Institute for Nurses, the New Jersey Association of Health Underwriters, the Community Food Bank of New Jersey, the Northward Center, Josh S. Weston, and by Century 21 Construction. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
When I grow up, I want to be a top chef. When I grow up, I want to be a CEO. When I grow up, I want to be hungry.
No child wants to grow up to be hungry, but that's the reality for 1 in 5 children in New Jersey.
Join the Community Food Bank of New Jersey and end childhood hunger. We need your help. You can feed our future. Feed the future of